Namaskar everyone. Welcome you all. Let us celebrate International Women's Day. मैं आप सबका स्वागत करती हूँ और आज हमारा ये दिन हम शुरू करने वाले हैं हमारे अपने डॉक्टर मलिक एचओडी डिपार्टमेंट ऑफ फिजियोलॉजी DIBNS की तरफ से। सर आज हमारे सामने एक टॉपिक जनरल व्यू ऑफ फीमेल्स इन हेल्थ सेक्टर पे अपने व्यूज प्रकट करेंगे। मैं सब ऑडियंसेस का स्वागत करती हूँ और स्वागत करती हूँ डॉक्टर मलिक का, जिन्होंने अपना टाइम निकाल के हमारे समक्ष और हमारे साथ इस विषय पे बात करना पसंद किया। वेलकम डॉक्टर मलिक एंड नाउ आई वुड लाइक टू हैंड ओवर दिस माइक एंड द स्क्रीन टू यू।
Thank you very much. Thank you to all, as well as I must like to congratulate all of the females, the women in particular, and we are in fact very happy to see you here, and we are joining once again all together for this beautiful purpose. Well, good morning, everybody, my dear my dear faculty members, my dear HOD ma'am, Dr. Deepti Wariko, my dear lovely student as well, and my dear students, dear staff, and all the physiotherapy faculty, my dear students as well. I know that they are also with me in the line here. So today, at this juncture, I can say that we are observing this day as a Women's Day, right? So while wishing you all, ladies in ladies in particular, and gents in general, but why I included gents today, included men's today, because it's very because we know that already we know that women's might not have supported the men's, then there will be no man's land. As we already know, for the promotion of any of the gents in this world, there might be a handoff very ladies itself. They know how to support the family, and they know how to support the each and every family member. The day when we say that our home, our family, our generation are just because of the females, are just because of the women's, then otherwise we can progress. So, considering the high maternal deaths, I must be very precise here right now. So, considering this matter that there are high maternal deaths in the developing countries, as India is also a developing country, dear friends, 99% of the maternal deaths occur in the developing countries. And we are here right now observing that something right is going on in the society, particularly for women. It's not like that. Just have a visit for 1 to 2 days in the female ward of government hospitals and government medical colleges. You can understand the real situation of life, what is going on in India. We are looking these 20, 30, 40 females in the Dolphin campus. They are all smiling, wishing, teaching, doing every type of purpose. You know, they seems happy. They look smiley. They feel like good. But had you ever thought of the struggle they had left at the home? They had left the entire family, you know, and then otherwise by providing them a piece and loaf of bread for their whole day. Then they had visited to the dolphin campus to work. Every person must understand this. Since back World Health Organization in 1987, yes, convened a conference at Nairobi, Kenya, and the objectives were laid down there. So many objectives were laid down there because to enhance the quality as well as the safety of the girls and women's lives through adoption of a combination of health as well as known health strategies. Many things were written before to it and many things at that conference and many things did came later on to observe the life of the females. We are working only 3.78% for the females in the entire world. Only 3.78% of for the females we are working for the entire world. And where does India exist? 0.26%. Now, where does dolphin exist? It's on a very high scale. It's a very good scale where we can see faculty in the form of females doing good job. They're doing good job. We must here to understand them. They're left on struggle right from the beginning till this stage and till the end of the life. Keep on struggling. So as you see that, if I talk about women's, I will talk about particularly at the maternal's health. वो जो माँ बनने जा रही है वहां से जिंदगी एक अलग शुरुआत होती है यार. So maternal health, if mother will be okay, she can keep her child okay. She can maintain the health of her child. So maternal health and the child health promotion is one of the key constituents of not only me, not only society, but the whole world. I can say the WHO, World Health Organization. And this WHO constitution is working day and night to how to promote, how to lift, and what are the objectives, what are the backstories, what are the obstacles. Every time they are thinking for it. Can we think for 5 minutes in 24 hours for the females? Even not in our family. The mother which is providing us bread 3 times of meals without any complaint. And she is the least food intaker in her stomach, providing every type of nutrition to the children and to the every family member, and giving herself as nothing. So, dear friends, we must be very happy in the society where we praise females first. We always say women's first. And for particularly, if I take as a safe motherhood initiative, Safe Motherhood Initiative, which is primarily aimed to reduce maternal mortality and maternal morbidity, both. There must be widely available family planning services to prevent unregulated pregnancies and are too early, which are too closely spaced. We must have a perfectly immunization strategy which is to be adopted, where I can see that so many poor families in village area, they even did not think for adoption of immunization schemes. Qualitative antenatal, qualitative internatal and postnatal care is one of the important segment where we can able to promote women's. We can improve nutritional status. We know how to improve, but it's very important to keep updated and can educate females for their nutritional status, particularly in girls and women. Prevention as well as treatment of anemia is one of the important factor. If I say girls or 50 students of a class, 50 of the girls are there, at least 75% of the females will be anemic. So promotion, prevention, and treatment of anemia is no doubt must be on the high scale. So promotion of breastfeeding. Here, education comes first. That how do we ask females that breastfeeding is one of the most important segment. So we had to try to improve the literacy rate among women. Where at this moment I can see that we must know how to improve social inequalities among women. We are not socially good if we are not uniting women among us. So, as far as society is concerned, community is concerned, different localities are concerned, different type of females are there, their education, their nutrition, their adoption, their immunization strategy, so many things are there which are revolving all around the females area. You educate one, you give good education to a one female, she can educate at least 20 people at a one time. Now people know how to understand females. They can understand the language of females. So here, there are so many speakers today. They are going to share their thoughts later on. And by the time I'll be moving to my clinic for 2 patients waiting for me, and both the patients are females, on this Women's Day in the morning right now. So better you continue with your thoughts and try to implement these thoughts in your life, to give regards and respect to the females, one of the important segment in life. So wishing you all the best for this day. Hope you can understand my words perfectly. Once again, keep forward, put your thoughts forward, do not hesitate, and prolong your Women's Day. Once again, congratulations for this day. Thank you.
Thank you so much, sir. I, Dr. Ritika Mani, on the behalf of Physiotherapy Department, thank you from the bottom of my heart as for taking time from your busy schedule. Thank you so much, sir, for your
Thank
presence
you.
and your enlightening words. That
Thank
will
you. Thank you.
definitely inspire us. Thank you, sir. Thank you so much.
Okay.